Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone. Today, we're going to talk about betamethasone and loratadine. If you've ever wondered what they're for or how to take them, this video is for you. Let's start with their uses. Betamethasone is a corticosteroid, which means it reduces swelling and allergic reactions. It's often used to treat problems like dermatitis, asthma, and some autoimmune diseases. Loratadine, on the other hand, is an antihistamine that relieves allergy symptoms such as sneezing, itching, and watery eyes. So how do they work? Betamethasone works by calming down the immune system to reduce inflammation. Loratadine, on the other hand, blocks histamine, a substance our body produces during allergic reactions. Now let's talk about how to take them. The dose of betamethasone varies depending on the condition, but it usually starts with a high dose that is gradually lowered. Loratadine is usually taken once a day, preferably at the same time to create a routine. It's important to be aware of the possible side effects. Betamethasone, if taken for a long time, can cause muscle weakness, weight gain, and mood swings. Loratadine can cause drowsiness and dry mouth, but these are usually mild symptoms. Finally, remember to always consult with your doctor before you start taking any medication. Follow the dosage instructions carefully and pay attention to possible interactions and side effects. Take care and see you in the next video.
If you've made it this far, let us know in the comments why you're using this medicine.